Welcome back. As we just reported, the 9/11 health care bill just passed in the House late this afternoon. And Seaford Congressman Peter King joins us now by phone from Washington to talk about the vote. Thank you very much for joining us, Congressman.
You're very welcome.
Now, I know you tried to get more Republicans to support this measure. Why was it such a tough sell?
Well, the fact is we passed the bill. That's the important thing. My main goal all along, ever since July, was to have this be brought up where a simple majority could pass it. And we got over 260 votes. That was the key thing. We did have 17 Republicans, but more than that, the fact is the bill went forward. This is what I've been asking for the last several months, that this be brought up so that people could vote up or down, yes or no. That's what we did today. So this is just a great victory.
Okay, it is a victory, but, you know, back in July is when it was such a disappointment to many of the people who support this bill. Was this whole thing longer, more dramatic, more partisan than you expected?
It was much longer. It was drawn out. And it wasn't just Republicans. There were also a lot of Democrats creating problems here. The fact is that the politics on both sides, which prevented this bill from passing before. But it did pass today in a full bipartisan effort. I felt very good that the Speaker of the House, when she spoke on the House floor today, went out of her way to thank me for what I had done to get it through. The important thing is we've gotten the bill through. It was ready to go several years ago, then it was pulled off. Now it's back. We're back on. We finally got it through, and now we have to get it through the Senate. But it was a great, great victory for the police officers, the firefighters, the emergency workers, the construction workers. We got it through with over 260 votes.
Were a lot of them there today? Did you have a lot of the Long Islanders?
In the gallery, yeah, there was a lot of firefighters, especially, many of whom lived on Long Island. I mean, afterwards, it was really a good feeling. It was actually bittersweet. It was a good feeling to be able to talk with so many people from Long Island who were there. The bad part of it is that these people are very sick and they're suffering terrible illnesses, but I give them so much credit for being there, for taking the time to be there. It was just, and for putting their effort into it and helping to get this bill through.
Okay, now we just have to see what happens in the Senate.
Absolutely.
Okay, thank you, Congressman King.
Very welcome.
A bill to give billions of dollars to workers who got seriously sick after working at Ground Zero has passed the House. Similar legislation is now pending in the Senate. Jackie Hyland has the latest.
After years of legislative wrangling, the House finally passed a bill today that will provide health care for first responders sickened by the 9/11 terror attacks. Congresswoman Carolyn Maloney called the passage a long overdue victory.
To the living heroes and heroines of 9/11, we have very good news. Help is on the way. We passed your bill in the House of Representatives.
The James Zadroga 9/11 Health and Compensation Act, named after a police officer who became ill after working at Ground Zero and later died, passed the House by a vote of 268 to 160. Today, Zadroga's father, Joseph, was in Washington to witness the vote.
I was so overjoyed when that bill passed today. I literally had tears in my eyes.
The House gallery was filled today with busloads of 9/11 responders who came to witness the outcome for themselves. But passage of the bill did not come without a fight. Democrats maintained the government had an obligation to help the first responders to the deadliest attack in U.S. history, while Republicans complained the $7.4 billion price tag was too high. Republican Peter King acknowledged there were differences of opinion on both sides.
Really, what we did is what we had to do. What you did is what you volunteered to do, what you chose to do. You put your lives on the line for us, so the very least we could do is what we did say.
The legislation still has another hurdle to cross.
I hope that the huge margin, over 100 votes in a bipartisan way, will be an eloquent message to the United States Senate that we want this bill passed and we want it to be passed soon.
The bill is not expected to be taken up by the Senate until after the November elections. President Obama has said that he is eager to sign it. In Manhattan, Jackie Hyland, Pix 11 News.